r/AskReddit. Doctors/nurses of Reddit. What is the most obvious case of a patient faking it you have ever seen? Not the most obvious faking, but the craziest. Drug seeking taken to the next level. Young person with admittedly serious history of gastrointestinal issues, portal vein thrombosis, faked a GI bleed. How the hell do you do that, you ask? Went to the ER with a picture of blood in a toilet saying they threw up a lot of blood. Immediately put 2/4 in bilateral axe, 1/4 in each inner elbow, and started working them up. Says they have to go to the bathroom and allows them to walk in there cause they still seem strong enough. Comes back out and said they threw up again. Blood was everywhere. They get whisked away to the ICU, my unit, for immediate intervention due to the amount of blood that has been visualized. Called the on-call GI doctor, got a unit of blood transfused without checking their blood count again. To stay ahead of the gross loss of blood, they throw up in the bathroom again with same bloody show. Though they aren't pale and still strong, blood pressure is still good. They're young and maybe can handle more before showing signs of deterioration. They are then sedated and intubated to protect the airway if their bleeding is that bad, and an EGD is performed to find and stop the bleeding. EGD is perfect. Nothing is seen. Went down with the scope a second time just to be sure. The GI doctor says there is no bleeding and doesn't know what to make of it. Everyone's confused. Nurse starts trying to figure out why. Finds an empty, bloody syringe in the patient's pocket while they are still out cold. This person took a saline flush, emptied it and used it to draw up blood from their fourth, and then proceeded to squirt it all over the bathroom to fake them throwing up blood. Even squirted some in their mouth the second time to really sell it. Patients so said they've been a drug seeker before and that they will stay as long as we give them drugs. We removed both fourths before they woke up, then explained to them nothing was found and they are perfectly fine, but we did find the syringe. Patient gets angry, says they are gonna leave. That's fine. Sign this form. Your insurance might not pay now. We'll call you a cab and pay for it cause you're still just recovering from being fully fucking sedated and intubated for that EGD. Patient denies cab and walks home with no cell phone or wallet cause their SO had abandoned them as soon as we explained the patient was not bleeding. Not sure how long they had to walk or how far they got. Sad we couldn't do a psych hold. The patient probably needed some help. Craziest one I've seen. TL. Doctor, patient faked a GI bleed by squirting blood from their fourths in an attempt to get drugs, and they got them with a full unnecessary invasive procedure. When I was younger I thought it'd be really cool to have glasses because my mom wore them sometimes. So when my 3rd grade teacher approached me one day and told me she'd been noticing me squint at the board while taking notes and was sending me down to the nurse's office for a quick eye exam, like she was supposed to do, I realized I could milk this for all it was worth and finally get my sought after pair of glasses, just like my mom. So I was scheduled for the nurse's office the next day and my teacher called my mom to let her know to stop by at that time so she could talk with the nurse about it. And I played it up hard to the nurse and my mom. The A's were Y's and the J's were L's. To me, they were the key to getting my first pair of glasses. Failed the test, as expected. After I purposefully failed the school eye exam, my mom took me to my grandpa's office. He's an optometrist, to get another eye exam, just in case. My grandpa is this really big guy with a super deep voice and can seem really intimidating, even though he's a giant teddy bear, and I immediately felt bad about trying to lie to get a pair of glasses, so I faithfully took the test that time. Man was I surprised when my grandpa finished administering the test and went, "Yup, she's got our myopia gene, haha." I was astonished. Turns out the entire time I did actually need glasses. I had ignored my teacher's concerns about my squinting because I figured everyone did and that everyone would eventually get a standard eye exam too. And when I took the first eye exam and purposefully read off the wrong letters, I also wasn't paying attention to how much I was squinting to read them so I could falsify them like the school nurse and my mom were. I also wasn't paying attention to how long it took me to read them. Of course part of it was because I was coming up with a different letter, but I hadn't even taken my comprehension time into consideration. When I did actually get glasses, I was amazed to see that trees have leaves and fat clouds have outlines and don't just blend into the sky. I learned that my classmates didn't squint as much as I used to either. Hi all. I was a nerdoc in Boston, Manhattan, and NJ for 7 years, and then went back to training and switched to orthospine. Between those two specialties I've seen just about every form of drug-seeking behavior known to man, and doubtless even more have seen me. I have several pearls I can share. And before anyone jumps on me please, let me assure you these are simply reasons to look closely and not hard and fast rules. The top chief complaint for drug seeking is toothache. Back pain is number 2. Beware any young female patient with vague pain holding a baby. Very few people bring their baby along for an visit. There is usually someone at home to watch the kiddo. Not always, but usually. Beware serial dislocators. There are people out there who can dislocate and then reduce their shoulder at will. Think Mel Gibson in Lethal Weapon. These individuals frequently pop their shoulders out when they need meds, go to the get medicated, then bail. The giveaway is that they never follow up or have their shoulder fixed. Always observe the patient when they don't realize they're being observed. Watch them walk to the bathroom, watch them eat, park them close to the desk, and keep an eye on them. Then when you go to do a neurologic exam for their back pain with inability to walk/can't feel my feet, you're not taken in by their 2/5 strength throughout. Beware allergies to everything except Dilaudid, a very strong narcotic in common use. This one goes without saying, but important for the med students here to keep in mind. Beware the fake seizure. This is a common one, and usually more psych than drug seeking. Many of them can withstand very painful stimuli like the sternal rub, or, more rarely, the pen over the toenail maneuver. The dead giveaways, when they are post-ictal and laying there unconscious, pick up their wrist, hold it right over their face, and let go. If they are truly out it will smack them in the nose. If not, it miraculously falls above the head onto the bed. Works every time. Most patients don't know neuroanatomy. Herniated discs or spinal stenosis do not cause circumferential my whole arm is numb type symptoms. Also, be sure and draw out the borders of the numbness. If it goes all the way around the extremity in a stocking/glove pattern from the fingers/toes up, it ain't the spine. Our bodies aren't wired that way, but most drug seekers/malingerers don't know that. Beware the patient with a folder full of large piles of wrinkled, messy, disorganized medical records that show how sick they are and why they need pain medicine now when they have no records in your own system. 99 times out of 100 the studies that prove they have a painful condition will be missing or incomplete. They are counting on you not taking the time to sift through that big pile of crap to figure this out. Also note that this is a pretty bush league technique. These people always give themselves away pretty early. The real pros won't do this. They'll have someone's borrowed baby. Beware hemophiliacs, Crohn's, and sickle cell patients. In their defense, this is basically not the patient's fault that they are addicted to narcotics. Most have spent their lives dealing with recurring exquisitely painful flare-ups that are appropriately treated with narcotics. Tolerance and addiction are inevitable, and with that comes the daily visits and faked symptoms. I never fight these people. They've got enough to deal with, and a squirt of Dilaudid and Benadryl isn't going to hurt me or them. It's all in the voice. For some reason, many people addicted to narcotics develop a nasally, gravelly quality to their voice. I can't accurately describe it, but just as some people can smell DKA from across the room, I have many times heard the voice and caught a drug seeker who was otherwise really doing a bang-up job. I don't care if they are there for a band-aid. If you hear the voice, look closely. And finally, never assume drug seeking or secondary gain without objective evidence to prove it. Drug seeking patients develop medical problems the same as everyone else. More frequently, in fact. Make sure there is something off on physical exam. Usually a neuro exam catches them, or some inconsistency in their history they cannot explain. Unless you know the patient well and have seen them many times before, never arrive at a diagnosis of malingering or drug seeking unless everything else, even the weirdest zebra, has been ruled out. Basically med students and junior residents shouldn't be making this diagnosis at all, no matter how convinced they are, as they don't have the experience level to know when everything else on the differential has been truly eliminated. Most important point. It is far worse to refuse help to someone who is truly suffering than it is to give a few pills to someone who you know is lying to you. And make no mistake that these patients are suffering as much as anyone else there. Give everyone one free pass and the benefit of the doubt, no matter how silly they come off. Make sure they have the ability to follow up with a provider, and if not, help them to get it. Social work consult, etc. If they neglect to do so, then it's on them. Learn the names of addiction specialists and resources in your area and offer it to these patients in a respectful and non-judgmental way. If you are refusing medication to a drug seeker, they are going to hate you anyway, so don't worry about insulting them. And finally, remember this: when you correctly diagnose a real condition in someone who other doctors have dismissed as drug seeking or crazy, not only will the patient love you forever, but you will feel better about yourself than if you had caught 100 drug seekers. Not a doctor or nurse, but a patient who was obviously faking it. I had suffered a severe spine injury at work, so bad that my co-worker said it sounded like a twisted wad of bubble wrap being popped. After 4 days of suffering in my hotel room, my employer flew me from Myrtle Beach to Kansas via Atlanta and Dallas. By time I got home at 1 AM Saturday morning, I was ready to die, and my roommates took me to the hospital. That was when I met Dr. Man with Joel's name, who gave me Tylenol 3 and told me to walk in at his clinic on Monday if I still wasn't feeling well. Mind you, my roommates had to carry me to the car, then from car into the hospital, and they had to sit me on the toilet when I had to shit for that entire weekend. So I show up at clinic with my parents. Roommates had to work first thing Monday morning, wait for an hour to see Dr. Man with Joel's name despite there not being a single patient in the waiting room. My dad was so furious he finally just marched to the nurse station, where Dr. Man with Joel's name is drinking coffee and gossiping with nurses about me, saying I'm a seeker and would go away after a while. My dad demands they see me immediately. So my dad wheels me to the patient room and Dr. Man with Joel's name says he'll schedule me for an MRI that morning, so we can get to the bottom of this stunt. Fucking stunt. We rush to the city to get to my MRI appointment on time. Go through all that, and they tell me the results will be sent to Dr. Man with Joel's name overnight. Next morning, my parents take me back to local clinic for another walk-in appointment and the waiting room is packed. So I expect to wait all day, and I'm ready to just go to the veterinarian office and be put down. But I didn't have to wait, because 2 nurses come out right away to take me to a patient room. Dr. Man with Joel's name walks in right away, sits down and starts to explain that I have 3 extruded and fragmented discs and 1 ruptured disc that I need to be in surgery by end of the week. So he's referring me to Dr. Top Spine Specialist in region who will make space to see me the following day. Oh, and here's enough painkillers to knock out a herd of elephants. My dad then says, "That's one hell of a stunt, son," and gives Dr. Man with Joel's name a "I'll strangle you later" look. But of course this was all from a workplace injury, which meant a workman's comp claim. So it would be another 5 months before my surgery, and I never had post-op physical therapy because the surgeon said I didn't need it. Thus the workman's comp wouldn't pay for it, and I couldn't afford it. So I just did the exercises my friend's uncle, PT, taught me to do. It's been 14 years since then, and I'm still all sorts of messed up thanks to a botched surgery by the cheapest surgeon the workman's comp company could find, and kept on retainer to handle all the back injuries on their insurance. At the pain clinic I go to, I've met at least 7 people who all had the same surgeon, and like me didn't have a choice in the matter because their injuries happened at work. It was from those people I learned that surgeon has a well-deserved nickname of the Beard Butcher. Doctors aren't always a good judge of who's faking and who's not. If you have a health issue and your doctor, or any doctor for that matter, won't believe you, then keep looking for a doctor that isn't a worthless pose. Edit to add, also if you are a faker, don't be an asshole. You make it very difficult for people who are actually suffering to get prompt medical attention. I worked on a neuro unit, so I took care of patients with seizure disorders quite frequently. We had some rooms that were specifically for people to come in and have their seizures induced in a controlled environment while hooked up to a machine that monitored their brain activity. Some people had legit seizures, and some people clearly had googled how to fake a seizure, but didn't understand all the small things that health professionals notice that can tip us off when a seizure is fake. During a true seizure, a person will be unresponsive, meaning you can say their name, lift their arm and drop it, etc., and they won't respond at all or remember what was happening during the seizure. One time, I walked into the room of a patient who we suspected was faking his seizures. I tiptoed in quietly while he was convulsing in bed with his eyes closed, so he didn't know I was there, and lifted up the plastic cover on the control unit at the end of the bed. I slammed it down, startling him. He jumped and stopped convulsing for a second, and then continued. He was definitely faking. Another time, I was in a patient's room with my coworker, and we were discussing giving an intravenous medication to stop the seizure that was currently happening to my patient. I said, okay, document that I'm giving the med. And as I said that, I first flushed the patient's fourth with sterile saline to make sure that the fourth was patent. My patient knew that the medication my coworker and I had mentioned would stop the seizure within seconds. It also can give a euphoric, sleepy feeling, so a lot of people like getting it, and he stopped seizing almost right away when he felt me push something through his fourth. The problem was, he didn't realize that I had only given saline and hadn't given the actual drug yet, so if he was really having a true seizure, saline would have no effect and he would have continued seizing until the actual med was given. I had a friend that I made in a support Crohn's disease group. Ironically, she had the same doc as me. I never did tell her that, but it was obvious she would fake how bad her disease was to get pills. When she had a doctor appointment roll around, this girl was the happiest she could be. And if she didn't, this chick was in the ER 2 or 3 times within a week. She would even post from the ER stating they gave her X, Y, Z and she's feeling a lot better. One day, she started to blow my messenger up about how much pain she was in, and how she hates life, and how I'm her best friend, which really freaked me out, because we barely talked. I wrote back as supportive as possible, and we only knew one another for a week. She started to tell me she loved me and all this really creepy shit. Well, one day she started doing that same shit again and just spilling out her love for me and how I'm her best friend. I have no doubt in my mind that she was faking it, and pisses me off because she sent me a piece of paper of her medical stuff that was a little lower than normal, like she was hiding something in the pic. It said she didn't have severe Crohn's, but mild mucosa inflammation. Well, here I'm with a horrible flare, avoiding the ER at all costs, and going to my doctor appointments as normal. She goes to the same ER as I do, and I legit was in so much pain in 2017. I went in, and the doctor looked at me after hearing me say Crohn's with bowel intussusception, which was completely honest, and he said to me, we won't be getting rid of the pain. I just want to choke this girl, because she makes those of us with real problems look so fucking bad. It's already hard enough having a shit disease. I told him IDC, just make sure the blockage isn't requiring some medical emergency surgery. I ended up having more than one and they treated. It's fucked up that a patient has to sit in pain because people who come in there and fake it. I can understand the doctors who look at patients like, yeah right, but please, for the love of God, before you just cut a patient off, do your tests quickly and give them the benefit of the doubt. See how many times they've been to the hospital, their diagnosis, their meds, look at everything quickly. I hadn't been to the ER in ages. They treated me like complete shit. I found out 2 days later, the cops had to take her out of the ER, and it was only a couple days before I ended up in there. I deleted this girl off my accounts. I ended up having to change my number after she went through my list on a fake account telling someone she really needed me. I haven't heard from her since, but she has still tried adding me on fake accounts. She tries following me on Snapchat and everything she can under her real name, etc. It was out of this world. I see what meds do to people and how hard the disease can come down on someone to where they give up. But me? Screw that. I have this disease, it doesn't have me, so I'm fighting like hell to get better. But seriously, try to give your patients the benefit of the doubt. We truly aren't all bad. Specifically, those with bowel issues, serious issues. Even if you don't quite understand and you're learning, get that quart, or whatever you feel the patient needs for diagnosis, and see what's going on. Above all, please don't be an obvious jerk about it. Honestly made me feel more hopeless. Yes, I understand one patient can really screw it up for everyone, but damn, some of us really do care about our lives. Thanks to the docs who work so hard all night/day to keep their patients alive. And on behalf of all shitty patients, I'm so damn sorry. Edit. Spelling. Quite the opposite for this one. I had a young PA absolutely convinced I was faking for pain meds. The nurse, though, wasn't sold on that thought. Long story short, I cranked my right pinky toe against a door jamb with such gusto, force, and follow through that I not only dislocated it, but split the bone down the center. My wife was at work, and I was watching the kids, per usual, and she couldn't be reached by phone. So I called my dear old mother. After my mom got to my house to watch the kids, I drove myself to the hospital. Sure, it fucking hurt, but I wasn't going to call an ambulance unless I was bleeding to death. I get there, I park, I hobble to the front desk, and while doing so, my toe relocates 0/10. Would not recommend. Anyway, my hopes that they had an urgent care separate from the ER were in vain, but they were nice enough to have someone from security drive me the 1/2 mile or so around the building to their ambulatory ER. I get seen. At this point the incredible pain paled in comparison to the relocation, so when I deadpan 5 to 6 out of 10 for pain to the PA, while adding that a pinky toe really seems like a useless appendage and suggesting amputation, she just rolled her eyes and sent me to x-ray. I didn't realize she thought I was a seeker until after my x-rays had been reviewed by the radiologist, and she came into my room apologizing up and down about how my toe was really broken. Like that fact was the surprise plot twist of one of her Nancy Drew novels she was probably reading between seeing patients. Anyway, the best part is the nurse, an obvious veteran in her trade, said to me right after the PA had explained that there really wasn't anything they could do for a pinky, given me a script, and stepped just outside the room, still within earshot. The nurse clearly states, clearly enough for the PA to hear, she's new, she doesn't really know what she's doing. Get that script filled, go home, have a couple of beers and relax. I was/am the stay-at-home dad. I work part-time, but my full-time job is our kids, the household and the cars, and my wife. I had explained that while bsing, and I think the nurse thought I deserved a night off, and I got it, but I was back at it first thing the next day. I'm an eye doctor and I get a slew of kids every so often that insist they cannot see, but this was an adult, and this case kind of takes the cake. It was an individual that was pretending to be blind because they wanted disability benefits. I can't give too much away because of patient privacy laws, but this person would regularly come into the clinic with stories about how someone threw acid in their eyes and was now blinded. pH strips came out neutral, no damage to the ocular tissues ever actually noted. Usually there would even be photos in the chart to back up that the tissues were unharmed. Stories of how they got hit in the eye really hard and was now unable to see, etc. This person had a habit of refusing to read below the boogie. Now, we have ways of figuring out someone's prescription, even if they are completely non-verbal. We can figure out prescriptions of babies, of special needs patients. So of course, this person's prescription was verified several times and rechecked several times, and it was correct. They just refused to read the lower lines. In eye care, you need to have medical reason for why a patient cannot see 20/20, so all sorts of tests were done. Scans of the retina, even VEP, visual evoked potentials. Basically, we hook you up to a machine that tells us if your brain is getting signals from your eyeballs. It's very rarely used TBH. MRIs, Connecticut scans, all came back functionally intact. This person would always throw his visual field results test where you push a button. Whenever you see the light, his/hers would come back completely black, as if she/he had no light perception at all. Yet they would shake your hand when you walked into the room, navigated rooms and hallways perfectly, never needed assistance to get into the chair, used their white cane incorrectly/never actually used it in order to check surroundings. Eventually, a doctor, not myself, I was an intern at the time, managed to trick him/her into reading a lower line. They lied to the person and said we had a special lens that might help him function better since he/she was so blind. They wanted to test it and told them that you're going to see the biggie, but it's going to be smaller than you normally see it. They showed him a 20/20 and the person gasped and went, "Yeah, I see it." New nurse here. During one of my pet's clinical rotations, my nurse and I admitted a new adolescent patient for a 24-hour EEG due to ongoing, intermittent seizure activity over the past few months, mostly at school. The patient came in with mom and grandma in tow. Everybody was totally chill and relaxed. Not even an hour later, as I'm walking into the room for whatever, I look over and notice that the patient appears to be seizing. I don't think that my nurse had even finished her admit completely yet. Limbs are loose, but with fine trembling. Eyes are rolling around behind closed lids. Seems pretty mild. I make sure my patient is safe. Call for my nurse. Mom and grandma are like, "Yeah, that it started about a minute ago." "I'm okay. Thanks for letting us know." They're still just sitting down, totally calm and fine. After my nurse gets there, she assesses the patient, and we basically just wait it out for a few minutes. Patient stops seizing, opens their eyes, and sits there quietly. Says no headache or any other perceptible symptoms. More assessment. We leave the room and nurse says she thinks the patient is faking. A few minutes later, I walk into the room again, and mom is in the process of leaning into the patient, but sits back hurriedly. Mom tells me patient is now complaining of a headache. My nurse finally gets around to asking the standard suicide questions, which she had totally been avoiding after reading the patient's history. Lots of depression/potential schizophrenia stuff, with requisite psych meds. Turns out patient is suicidal, has a plan, and has thought about doing it in the past week. Patient says he/she is only suicidal because of the voices. There are two, they have names, and then proceeds to tell me that the older one is the one that pushes suicide and the baby voice is the one who protects when things get too difficult. When questioned further, they aren't voices, but visual hallucinations that talk to her. Very straightforward and clinical descriptions. No reaction from mom and grandma. Now we get a sitter to stay in the room with all three of them. An hour later, same thing happens. Seizure starts right when we walk in the room. Mom and grandma still hanging out in their seats like this is no biggie. This time, it seems like somebody googled what happens after a seizure, because once the trembling ends the patient acts groggy and non-verbal for about a minute, and then complains of a headache, but everything back to normal in 5 minutes or so. Vitals normal throughout. My nurse is pissed at the patient for wasting her time, but I was pissed at the mom. The patient was faking, but who was driving that boat? I tried to advocate for CPS. It's child abuse in my opinion, but the best we got was a behavioral health consult. That was one sad kid. I wish I could have somehow followed up to find out what happened. Oh man, I've got a good one. When I came back from my first deployment, I was a Navy hospital corpsman, which is what Marines have as medics. I went from one company to another, and we had lost a lot of guys on the first deployment to popping hot on-pass tests for ecstasy. This was in 2000, so all deployments were just training deployments. Since the company was decimated both by guys on their first deployment getting bad conduct discharges, and second deployment Marines hitting the end of their 4-year enlistment, pretty much every boot Marine that was coming to our battalion got sent to our company. We had several hundred boot Marines, and a few months after they got there this kid arrived on crutches. You could tell the kid was up to something as soon as he got there. His name was Webb. I can't remember his first name. He clearly didn't want to be there. He gave my platoon sergeant some notes from a doctor saying that he had broken his foot when he went home on leave. We asked him what happened, and his response seemed rehearsed. I was really tight with the Marine he roomed with when he got there, and he kept saying that the Webb would write letters every night and stuff them away in a knapsack. Broken foot or leg, he was going to deploy. When we told him he needed to get the foot looked at by a military doctor, he looked like he was going to faint. My buddy, his roommate, told me that he thought Webb was faking the injury and just had a family doctor help him out by casting him. I can't remember exactly why, but he was completely convinced, and Webb kept putting off going to see our battalion surgeon. One day a Marine grabs me as I'm heading back from the morning platoon run and says Webb is on the floor of the bathroom and says he can't move. I went into emergency mode and ran to the room, had the Marine help me move Webb out of the bathroom and into the bedroom so I could assess him. I did exactly what I had been taught in EMT school. Had my buddy maintain C-spine alignment, checked for priapism, looked for pain reaction. Someone had run to the aid station and grabbed my friend Marcus, who was an independent duty corpsman or IDC, sort of like a PA for enlisted Navy corpsmen, and he did the same tests I did, but grabbed the hair on Webb's leg and twisted it to initiate a pain response. Webb claimed he couldn't feel anything, but we saw him grimace as Marcus pulled the hair. Marcus looked up at me and smirked. Ambulance gets there, and I ride with my staff sergeant to the hospital. The staff sergeant already hated this kid. He had been a scout sniper during Desert Storm and couldn't stand people who didn't want to be part of the mission. We get to the hospital, and since Webb is my Marine, I relayed all the information to the Army doctor. We transported him to Tripler Army Hospital, which is the biggest military hospital in Oahu. The staff sergeant and I told the doctor that we thought the kid was faking it, and the doctor smiled and gave us a look like, watch this. So since Webb is pretending to be paralyzed, the doctor runs all types of tests on him, has the nurses taking off all of Webb's clothes. So the only thing Webb is wearing is the C-collar, dung and all, to be seen by every other patient and doctor or nurse in this room. Then he has a catheter put in, and Webb still pretends to not feel anything. I've had a catheter before, and let me tell you, it hurts like a bitch, unless you're one of those people who has to wear one all the time. The doctor by this point knows he's faking it, but just wants to teach him a lesson. Now if any of you are physicians, you can tell me if this is something done, because I've never in my life heard of or seen a doctor do this. He grabs Webb's penis and the catheter and yanks it as hard as he can. Webb's ass lifts off the table and he yelps. The doctor asked him if he felt that. Webb said he did. Looks like he's not paralyzed and numb from the neck down. Needless to say, Webb was in trouble. He spent a couple days in the hospital acting like he was still hurt. The army surgeon did an x-ray on the leg, healed. Back in the barracks we made his life miserable. I almost punched him and threatened his life on several occasions. I was a bit of a hothead in my early 20s. My buddy who roomed with him dug up the letters he was writing and found out they were all being written to his congressman, and he gave him names, events, and was even planning on recording us. We took all the letters and documentation and shredded them. When Webb noticed everything was gone, he just stopped talking to anyone. Then he disappeared. One day they moved him somewhere else, and he wasn't in our battalion. Never found out what happened to him. But our best guess is he was charged with fraud and kicked out. Worst part is that when I realized Webb just wanted to get out of the military, something clearly changed his mind before he got to the fleet, that I had helped someone else scam their way out and keep their general discharge. During Don't Ask, Don't Tell, you could say you realized you were gay while in service, as long as you hadn't actually slept with a guy yet. I helped my friend write his statement to get out of the military that way. I would have helped Webb because no grunt wants someone around him who doesn't want to be there. But the kid just wouldn't do it the right way. Thank you so much for watching. Please like and subscribe the channel.